My name is Bianca Martinez, and for our week 3 assignment in Adult Health 3, we were instructed to complete a teaching video on the syndrome of inappropriate antidiuretic hormone secretion, for short SIADH. SIADH is a condition defined by the unsuppressed release of the antidiuretic hormone ADH from the pituitary gland or non-pituitary sources, and its continued action on the vasopressin receptors, meaning it makes it harder for the body to be able to release that excess fluid, causing the patient to start to hold in that fluid, causing the fluid retention. Common causes for SIADH can range from a mild cause to a more severe one. The most common that I was able to find was a brain infection, bleeding in or around the brain, head trauma, cystic fibrosis, and hereditary factors. As I was researching, I saw that a lot of the causes for SIADH had to do with some kind of head or brain trauma, or even just the common infections that tend to go and attack the brain. Some common signs and symptoms, like I mentioned before, just similar to the causes, they can start from a mild cause and build up into a more severe symptom as well. And the mild symptoms can go unnoticed for quite a bit of time until they have reached that point where they develop into a more complicated symptom that it's more easier for the health providers to catch it, not in time, but it'll be easier for them to see it and hopefully be able to diagnose it sooner. The common signs and symptoms are irritability, loss of appetite, some nausea and vomiting, and some more of the complicated signs and symptoms that I was able to find on SIADH can range from hallucinations, personality changes, and seizures. For medications that are used to help treat SIADH, were often which the main goal was to help get rid of that excess fluid. So immediate treatment of SIADH can include the intravenous furosemide and 3% sodium chloride injection to help with the water imbalance that can be occurring within the patient. Lasix, from what I saw in the different research that I was able to look up, is a common medication just because Lasix are used to help the body release that excess fluid that the body is holding onto and can't excrete itself. Another medication that I found that is used for SIADH is demecloxycline, which has also been able to use to collect tubal cells to help diminish the responsiveness of the antidiuretic hormone ADH. Interventions for the patient with a syndrome of inappropriate antidiuretic hormone secretion, SIADH, is going to be the first intervention, like I have previously stated, is going to help with that fluid retention. We want to make sure that is the main priority, to help the body release that excess fluid, beginning with the Lasix, depending on what the doctor has in plan for her. But first intervention is always going to be dealing with the fluid retention. It is also going to be really important to monitor the patient throughout the day, because if in the morning they might not have any fluid retention that you see, but it can fluctuate throughout the day real quickly. This is also going to be important to be monitoring their vital signs, because with the fluid buildup, their vital signs may be normal in the morning or within the hour that you had just take them. That fluid buildup can cause those vital signs to quickly change. So it is important that we are assessing patients with SIADH vital signs at least between one to two every 2 hours, just so if there's any sudden change, we're able to catch that far quicker. And it's also going to be important to monitor their labs for any electrolytes imbalance that have just suddenly appear, like I said, that with the fluid retention that can occur quickly, it can cause their vital signs and labs to just fluctuate at such a quick pace. So it's important to monitor SIADH patients frequently throughout the day. Complications that often occur is hyponatremia, which occurs in about 30% of SIADH hospitalized patients. Just because that number one complication is with the fluids, that is going to be their sodium levels is going to be low. Mild complications that a SIADH patient can occur as headaches, memory loss, and muscle cramps. More serious complications are a little bit similar to the signs and symptoms, which can include seizures, hallucinations, respiratory failure, to coma, and the worst case scenario is death. And that is going to be my teaching video on syndrome of inappropriate antidiuretic hormone secretion, SIADH. Thank you.